You guys ready?
Let's go.
So we have a couple of presentations tonight, but the focus is really just on some budget things. So first I have to move the abstract approval. Second. Yes.
Yes. Yes.
Yes.
Yes. And then I guess you want to do yours, because you're up first in this, in the agenda. What was it?
I won't be long. Hi, everybody. I just wanted to provide some exciting updates on the kennel and dog control side of things, kind of rounding out the year. It's been a minute since I've been to a board meeting, so. I did share with Cassie, just kind of a general outline of everything we've done this year with dog control. And the most exciting news on my end is that every dog that's come through the shelter has subsequently been adopted. So our number right now is 0, and we're hoping to keep it that way, at least for the long term. We've had a lot of community involvement. We're involved with Dryden Dairy Days. We've had a large social media following, so I just kind of wanted to, whoever's listening, thank the entire town of Dryden and all the residents for being so helpful with that. This community really came together back in January to support Dryden's dog shelter. So seeing that was great. Being a part of that was really great. And I don't know, it makes me proud to have grown up here and be working here. So
How many followers do you have?
let me look, I did write it down here. I think, what did I say? I think it's right around 3,000 or so. 3,500 Facebook followers.
Congratulations.
Yeah, so that's pretty big. We started the Facebook page in January, and that's really been the best way to get the news out to people, in my opinion, and get these dogs back to where they belong. If you're not on,
Has it helped with getting dogs reconnected with owners if there's?
yeah, I think that's the sharing of lost dogs or missing dogs, being able to provide neighbors with information that their neighbor up the road might be missing their dog. So just outreach in that sense.
No.
Yeah, she found that out. My dad, he sent for my wife, and she went on a hike one day and listened for about 6 hours, and so.
Yeah, Dan was pretty early on with the missing dog
But
search.
found Ginger. Now,
Yeah. Country Bears
amazing.
ended up picking her up. So yeah, I just wanted to go over some of those numbers. We have licensed over 500 dog licenses since January, which I thought was also pretty cool. When I started this job, I had no idea how many dogs were in Dryden, and boy, was I shocked when we were seeing numbers on dog enumeration, especially the amount of unlicensed dogs. So Dryden is a huge town, and not a lot of people really realize that. So I realize it at 9 o'clock at night when I have to go all the way over to basically Ithaca, but yeah, so just really some good news that I wanted to share with you in looking forward to 2026. The number one goal for 2026 is going to be to continue to keep the shelter at a population of 0. I have some ideas that I haven't really formulated into writing yet that deal with more of like the town dog control law that I'd like to eventually get to kind of tailoring in and zoning in on, just so we can have a more successful roundabout dog control position for everyone, including dog owners in the town. So the the other big thing is just I've built relationships with the coinciding towns, so Country Acres, SPCA of Tompkins County, they're kind of the ones that are right in our area, and we've all been pretty much working together hand in hand since the beginning, so that's great. And yeah, they're all really great people, and they also cover for me when I'm on vacation, so I have to be thankful of them and Tracy. But and dog enumeration is complete. Next step is to be ticketing anyone who still has an unlicensed dog. Any of you guys, if you have an unlicensed dog, go see Randy and get that done. So you don't get a ticket in the mail, but that'll be the next step going into the new year. All right.
Great. Congratulations.
Yeah, thank you.
Thank you. Yeah, for the thing with the dog law, it's like the person I had to talk to back then when you try to prosecute them, if there's an issue. Just give the town attorneys a call.
Okay.
Because if they have ideas of what could be changed, that's what we would,
Okay.
that's how we would do it.
I've had pretty good luck so far with my clients, so.
Yeah, and so I know that there've been just different times where people would talk about possible holes in the law, so. So, but since the attorneys there are the ones who I guess help you prosecute.
Would that be nice?
Yeah, start with Nate, but I think one of the other two, Gina, I think Gina or Mike would be the ones who are over with you. So that's who we should probably talk about when there's been issues, and then we can come up with something to present to the board.
Okay.
Yeah. Oh, yeah, Laura.
Hi. First meeting. Nice to meet everybody. This got started in July when Diane retired. How are you liking the job? Love the job. Love the job. This is the library that my kids grew up with. I've been in the area for about 25 years. Yeah, we lived in Dryden when we got married. I actually, the last time I was in this space was for a music class with one of my kids.
That was my friend.
It was pretty fun. Live and tonight.
I'll share the.
Yeah, that would be great. Thank you. So I shared a PowerPoint with Cassie about what we're doing at the library. Here we are. Thank you very much. Southbrook Library has been a cornerstone of the Dryden community for over 50 years, as you all know. The original library was built on Main Street, and about 2,000 books costing $2,500 were purchased to start the collection. And we had to maintain that in addition to the books. Let me flip it over to the Lincoln Center. Yeah, Lincoln Center edition. Sorry, going my presentation, programming, has everybody been? Absolutely, yes. So the Lincoln Center edition is our beautiful space. This is how I know the library to be, because we've had it for quite a while. Diane found the letter, we got a ton of money, we expanded, and it is very much a welcoming meeting space for everybody because of that addition. We can click over to the next. Thank you. Southbrook Library is one of the top performing libraries within the Finger Lakes Library System, which is 33 libraries. One library card gets you access to all of those resources. We provide materials, obviously books. A lot of folks come in for movies, but we also have a library of things. So you can get everything from a cake pan to a ukulele. No joke. And games and puzzles and things like that. We have a lot of hands-on and computer access. We'll talk about computer access as well. And we went.
So community members have things.
Yes.
Could be useful.
we could potentially catalog things.
Yeah,
Yeah.
I don't advertise for that or.
We don't generally advertise for it, but people do come in often. Very often, with books that they want to donate, with puzzles, with Legos. We have everybody coming in, cleaning things out, saying, other folks might be able to use this.
Yeah,
And if we can, we do. And if we don't, we make sure as we're accepting a donation that it can get passed on. But we have a library of things. If we can flip over to the next slide. We have something for everyone. Folks come in and they come in for story times. They come in for free computer access. They come in for book clubs. They come in for, did I already say story times? We have a ton of programs going on every month. And lunchtime learning, we provide everything from information about health and healthcare to cookie decorating. We had a jazz concert earlier this month. And once again, we're going to have a community conversation about the Dryden Center for the Community coming up on the 15th. Because people are asking questions and the library is the place to have those conversations. Today, I just confirmed a community conversation for next month with a dean from Cornell to talk about AI. Because that's an important conversation and that's his area of expertise. So it's awesome. If we can flip over to the next slide, please. Here is some data from 2024. As you can tell, we have quite a few people coming into the library and using it. We have a lot of programs, a lot of people coming to the programs. Libby, I don't know if anybody has that app. I love being able to do ebooks and audiobooks, computer sessions, summer reading, physical items that are checked out, people coming in. You don't have to have a library card through Dryden in order to use the library. Like I said, it's part of the Finger Lakes library system. A lot of people come in from other libraries. They're usually from Groton or maybe Lansing or what have you, but we have everybody who comes in and sign them up for a card if they don't have one yet. Can we flip over to the next, please? So some of our programs and events from 2024. And this was before I was here. So we do have a little pamphlet, a report to the community that Diane had put together before she retired. And that's where this data is coming from. Adult book clubs, preschool story times, Wednesday Wildlife in the Park is one of our summer reading programs. And here's our library of things. Dolls, we check out American Girl dolls. Dolls, microscopes, games, and so much more. We have the Pause to Read program on Saturdays with Cornell, and over the summer we did that as well. And that's fun. It's a reassuring way for kids to practice their reading skills because they can read to a friendly dog. We can flip to the next one. Yeah, 2024, we had 272 programs, 2025 so far, we're up to 197. 2024, we had over 8,000 attendees and we're almost up to 7,000 attendees and we still have a couple months to go. We're busy. We try to do a lot of different things and something for everyone. If we can flip to the next slide. Early literacy is so important. We have preschool story time every Friday at 10. There's Miss Stephanie doing one of the programs. We also have 1,000 Books Before Kindergarten as a program. So babies can have their own library card. And when you sign up and as you're reading and turning in your sheets, you get prizes to help encourage that. We also have a parenting collection within the kids section, and we have so many toys. And my kids as well, when they were little, this was like the best place to go on a rainy day, right? Like you brought a cup of coffee, you met some friends, and the kids read, and it's one of the best places in town, I think. Not that I'm biased. But I can flip over the next one. Thank you. You have programs for kids and for families. For the rest of the presentation, this is all pictures that I took since I've been the director in July. So one of our Wednesday programs, we did Color Our World this summer. So we had the kids making art all summer long with so many different programs. And what do I want to tell you? Yeah, so a lot of these programs that we do are funded through different grants. We have book clubs, game nights, team takeovers, and if we can flip over to the next one. Lots of different programs that happen. This one was in Montgomery Park. We go places to do programs. We don't just stay at the library. I was at Head Start recently to do a program, the VFW for Dryden seniors a few weeks ago. I don't know, it all kind of blends together. There's a lot of different activities that we do in the community. Can we flip to the next one, please? Yeah, some of our adult programs. So this is the little jazz concert I was telling you about, and one of our book clubs, we met at Dryden Lake Park to have one of our discussions, and we also have a writing group. Basically, if anybody wants to use the space for a community program, we're more than happy to oblige. As we can flip over to summer reading. So summer reading, we had a total of 265 people registered for the Color Our World program, with a total of 1,651 people attending our programs over the summer. And we collaborated with about 25 organizations over the summer. We are very much connected. If we can keep going, these are just some like fun pictures. Dan the Snake Man, the Agility Dogs. We can keep kind of clicking through here.
That guy's been forever.
Everybody loves them, right? We can keep clicking through, please. Our cartoon class for teens, and we had the watercolor class. We have one of the local farmers, a couple of farmers. We came out once in a while, like we had this whole series over the summer in the park. Okay, let's stop there for a second. So, and learning about different animals, hands-on experiences for kids, and you pique their interest and they learn more. And that's what we love to do. We love to help get people excited to learn more. We also partner with Head Start, Willowbrook, George Jr., the Dryden School District, Challenge, and Racker come on a regular basis. We've collaborated with a whole lot of groups. So this is before I was here in July, but National Science Foundation, Council for the Humanities, Families Learning Science Together, Center for Material Outreach, the Cornell Immunity Center. We partner with everybody in the area. And let's go to the next slide, please. Collaborations and special programs. Diane did the whole big village holiday extravaganza. We call it an extravaganza. And so this was a picture from last year with Santa and Bowie, which was one of the events. And then over the summer, we were very fortunate. Senator Leah Webb came to one of our summer programs, and Ms. Corbett was running that program, and it was an honor to have her come by. I was really grateful for that. We also collaborated, just a little footnote. So besides stories with songs and crafts, a free book giveaway, Senator Webb coming, we also had Cornell Lab of Ornithology come and do a little tabling because it was about kids. So, you have to call Sapsucker and see if they can go down too and put 2 cents in. Okay, can we go to the next slide, please? Oh, and free lunch. We also fed people. Because, that's that's a lot, right? It's a lot of stuff. How do we do all of this? We have an amazing team of volunteers, an amazing staff. I like our board of trustees too, and I'm not, yeah. We have a big community. We also have, we have full-time director, senior, 2 part-time assistants. 1 part-time assistant, 2 part-time aides. We have summer teams coming through Dryden Rural Youth Services. We have so many volunteers, and we have people not only volunteering to donate stuff, like you were asking mentioning before about donating to library things, they're also willing to donate their time. They're happy to come in and do a lunch and learn on whatever their expertise is. They're happy to come and do a workshop for folks. We really are a community hub. Okay, the numbers. So that is our operating income for 2025. And you can see the town of Dryden right here on the right. We have a lot of different sources of income. And we need all of it to help keep things going. If you want to flip over to our expenses, biggest expense is staff. So the cost of living continues to increase. Positions at the library include a retirement plan or health insurance. I'm just going to throw that out there in case y'all didn't know that. But to help offset the cost of health insurance, because it's expensive, the board did vote to give a healthcare stipend to the 2 full-time employees. So staff's a little bit more for that reason, which I think is understandable. Okay, and we flip over to the ones.
How many employees are there?
There's 2 full-time employees, 1 and then 3 part-time. And then over the summer, we have some teams, but that's paid for from a grant. And then we have volunteers. And then we do also contract out different people for different things, like we pay Dan the state man when he comes. But yeah. Okay, grants and additional funding. In 2024, we supplemented our income with quite a bit of additional funding. And again, this was Diane doing a lot of grant writing. And we partnered with a lot of folks. And on the last slide, please and thank you. We appreciate all of your support. And if you have any questions, I really feel like we do a lot to serve the community. I'm so glad to be here and to do all of the programs and services that we do provide. It's amazing what you do with the budget you have. So, very dedicated people.
You guys said use sort of a 5-year plan or a 10-year plan.
For budget or for programs.
Your strategic plan.
So.
Yes, we do have 5 years.
Yeah.
I haven't been part of looking at that yet.
You will.
I will. I don't know, and that's coming up, but it's coming up.
Sounds like I just assumed you did, but it's not.
Yes, yes, probably.
Well, I think you're one of our most important assets, whether it's about. You can do it.
Thank you.
I've been over there, so I should.
Any
A
other
little we go over there too.
Are there any big projects on the horizon?
big projects? I get very excited about the programming component of it. And I'm trying to kind of pace myself because there's a lot of important community conversations, like the one about AI that's coming up in November. There's a lot of good programs that we can be doing. We collaborate also with the other libraries within the Finger Lakes system that are the rural libraries. So, and I'm still trying to figure out what serves who best and what we can do to reach other people. So, yeah.
Thank you.
All set?
So much.
Yes.
Thanks.
Thank you.
Mike, did you want to do your county update? Sure.
I just keep my library head on for a minute.
Yeah, as long as you
So
don't
how probably I are who I were directed. And I want to point out, we've got 3 members of the board here tonight. Randy Stewart is our vice president and Bambi.
so you have a quorum.
Is our. And they're one of the trustees, where the other trustees are Cliff Brooks. Paul Streeter, Brenda Carpenter, and Charlie Garfield. And we do have a boiler project.
Could say your comment, if you look at the expenses, with the facility we have, obviously we have, maintenance to keep up and things go wrong, we can replace, boiler we put in 2011, the additional put it on. Basically died at the end of the heating season last year, fortunately. And we had to spend money to replace that, and we got most of it paid for through the New York State Library construction, so we had to submit a grant request, and which is quite a process. To do, but we got the money, and got the money yet, but we can ensure that. So. This again, ongoing expenses to maintain the facility. Mike, Charlie Darby, myself on the building committee, that's never a new problem.
If I say anything but budget, you're gonna be lucky tonight.
I think,
We've had 9 expanded budget committee meetings at the county. 6 of them were presentations from all our departments and agencies. And 3 of them were voting meetings for modifications to the proposed budget from the county administrator. We got through the amendments that we had as of last night. Doesn't mean there won't be more amendments, because next thing that happens is the recommendation from the committee of the whole goes to the full legislature at our next meeting, and then it'll go to public hearing at the end of the month, and hopefully will be adopted. But in the process of adopting it, it can be amended again. But I can tell you what the budget committee recommended, and that is we will increase the tax levy by 3.31%. which is just slightly over the tax cap, which is about 2.79%. And for the budget would be, the total tax levy amount budgeted would be $56,713,511. It would be an average tax rate of $486 per thousand, which increases the tax rate by 1.4%. The effect on a medium priced home, which is valued at $300,000 again this year, would be $20.08, would increase the taxes to a level of $1,458.07. Again, those can change, but we were down at one point last night, we were up to 7.17% above the tax increase in the tax levy. And we have adjusted sales tax figures, we adjusted fund balance, and we made cuts. And we've added things.
Does that mean the sales tax is going to go up?
What's that?
Does that mean sales tax is going to go up?
Sales tax has been kind of flat, and actually last month we were down like 600,000. So we're behind a little bit on the sales tax. This month, I think we get 2 sales tax reports. One is the regular monthly from the state, and the other is where they kind of go back and make corrections where they, for example, items that should be in our sales tax or our sales tax items may go to a different county, and they have to address these things back and forth. We may receive them.
but there's no talk about raising the sales tax.
Percentage.
We're talking about adding sales tax to the short-term rentals. That's going to happen. So that's going to add some sales tax for us. We also talked to the budget committee today about a proposal that's been brought to us to increase our room tax by 1%. Thinking that we may be able to use that for airport expenses. which is the airport is a driver of tourism in the area. The other big thing we've been doing is continuing to work on the homeless issue and the Code Blue shelter. We initially thought we were going to be able to have a joint project with the city at the old Burger King site down on Elmira Road. We'd still like to work with the city. The city would run a navigation center during the day to help people get the services they need, for example. And at night it would be a warming center for what we call the Code Blue, for which we get some state funding. We proceeded with that and started looking at what it would actually cost. It would be a rental building because it's owned by the McGuire dealership group, and they didn't want to sell it. They wanted to eventually do something different with it. So we were talking about at the most 3 years. We learned that we would have to put in a whole new sewer outfall line to the street. We would have to do the bathrooms and showers and other things. And the cost of that was so much more expensive than to outfit what we call the found site down on Cherry Street, which we already bought for the temporary housing project that we're going to be doing in the future down there for housing. And so the decision was made by the county not to go forward with the Burger King site, but rather to spend the money at the found site, which is actually larger. The building, there are 2 buildings there, the building will be using. And we have asked the city to consider the navigation site there. They're not as happy about that because it's further away from the camping area that they've designated, and I believe across the street. So we haven't heard back as to whether they're going to do that or not. The Center of Government building is proceeding. We had some folks come in and say to us, why don't you look at the Herald Square building on the Commons? And we have taken some time to look at that, and it's a nice building. But it has some drawbacks for particularly the rural population. It has to come down and park and other things down here. So that's not going to, nothing has happened with that except we have taken some time to look at it. Glad to answer any other questions, but those are some of the things that I've been working on.
Question I have, like, what's the sales tax? Since the state collects it, they said anything if they're not getting money that they're owed, they could hold like back on suit or something at all.
None of the sales tax.
I mean, like, just because they have to. That they have a cash flow.
That would be the state.
Yeah, the state. No, I'm just wondering because like if there's money or well, there's all these different projects from, that they're playing games with where they're holding money back. If the state needed to make payments to things, we want the funds of actual money coming out of sales tax. Or because they disperse that back to the county, right?
Yes. Everything goes to the state.
Like if they're gonna have they said anything if they're gonna end up having like delay payments on?
No, we don't do anything like that.
That's good.
I hope we don't.
Yeah, I like
But we are hearing very difficult rumblings about Medicaid, particularly for people that have been getting the lower cost health insurance through the Medicaid programs. A lot of lower income single people. And I talked to one of these people who got an email from their broker yesterday saying that they probably would lose their coverage under the beautiful bill next July.
Yeah, so I know Miller's is fine about that.
Also, we're very concerned about the food security and what's going to be happening with SNAP. Supplemental assistance, I forgot what the acronym is, but
Supplemental nutrition.
nutritional. And that we may be hearing about cuts even more quickly, or maybe next spring, that those are being cut back.
Well, they're announced that the educational program in every county has been ended. Like effective
Or SNAP.
for SNAP, the educational, they really teach people how to cook and do a lot of other things. That program's already,
We already saw, I'm sorry. We already saw an 18% increase in the consortium's costs for health insurance this year. First time we've had a double-digit increase, and of course you know about that. And that's really causing trouble for the low income, particularly retirees from our county. So we just instituted a new lower cost plan, actually through the Binghamton group, which is a Medicaid Advantage plan, which is going to be an option for retirees.
I have a question. This might seem a little wonky, but I've been trying to figure it out this week. So last fall, the county entered a $600,000 contract with Centralis to run Kiva Addiction Recovery Service, right? Ours. And they were going to take over the operation in Trapano River.
Yes,
Has that opened yet?
no, not to my knowledge.
Do you know?
We keep asking about it. I think they were waiting for a grant from the state to into Cuba, Centralis. Maybe. I'm not exactly sure of all the details, Dan, but you're right. And we'd certainly like to see that get open.
Your former health commissioner, Frank Cooper, it's on point with that. And that was part of his new portfolio work with Centralis.
Yep. That, by the way, has now become a trustee of the Tompkins Cortland Community College. He was appointed by the county. And I don't see Rick here, but today it was announced that we have a new highway manager, director, and that will be Nick Ensign, who has been the deputy, and he applied, and our county administrator appointed him, told us of budget and personnel today that had happened. He's been serving as interim, and county administrator said he never had so many unsolicited comments asking us to really strongly consider Nick for that job. And so I think that speaks very highly of the appointment.
Right. Hired.
I'm sorry?
You hired from within.
Yes, we do. We do both. Well, I've probably talked long enough here. Thank you all.
Thanks for the effort.
Tom, did you want to just, will you get a hand that letter out that I read it?
I just want to read this letter in and then I'll sign.
Okay, yeah, I'll let you. Just, if you go up there and sort of one of the mic gets it. Then Greg, you just brought the guys with more.
Yes.
You all know me, I'm Tom Wandel, Fire Chief at Adna. We obviously, myself and you guys have not got along very good in the past. And I can be kind of a hothead sometimes when I'm told I'm not doing my job. So I just want to apologize for all my past indiscretions against you guys. It was nothing personal, just I got heated, and so I sent this, or I give this letter to Bambi a week ago or so. I'm just gonna read this and I'll be on my way. Said, we respectfully request reinstatement of a contract for the fire protection service for the Adna community as previously covered for the last 50 years. as we were unable to agree on a contract and unable to work together for 2025, we'll continue operating behind the scenes and we're able to observe and listen to surrounding departments still struggling with responses, manpower shortages, as well as multiple activations to respond to calls. We're not requesting additional response area in any way. However, to provide strictly fire protection service to the Etna community as we have in the past. This was also include continuing with automatic mutual aid during our responses, as our primary goal is to expedite response, manpower, equipment to the Etna community. Volunteer fire service is a struggling system, not only locally, but nationwide. And forcing a volunteer fire department to close its doors is not the answer. We've maintained our equipment properly, including the Etna Fire Training Center that numerous departments have continued to use throughout 2025. Our requesting response would be for fire protection such as service calls, fire calls, MVAs, wildfires, etc. We're not requesting to respond to rescue calls because obviously that was our setback for the previous. However, we are willing to provide assistance for serious Delta and Echo calls such as CPR in progress, manpower requests for lifting assistance. We respectfully request your serious consideration in the following Etna Fire Department to continue to provide fire service to the Etna community as well as our neighboring departments in the 2026 and willing to provide performance-based reports quarterly if necessary. Thank you for the consideration. It's a very serious matter that in the volunteer fire department.
Thank you, Tom. Great.
I'm just giving you the report from year to date, basically. Total call is 438. Average personnel is 7, which is really good. Average en route time 3 minutes 14 seconds, and average on scene time is 6:58. If you have any questions, I can answer them. If not, I believe we get this in an email. So
Yeah, but like you said, how many of those are fired? Curious.
So 228 of them have been EMS. The rest of them are fire, whatever that math is.
Yeah.
Because it breaks down the fire and
Two
structure, NBAs, fire alarms.
Yeah.
So half and half.
Yeah, there was something today, right? This afternoon.
There's been stuff every day. Yesterday I ran 4, today I ran 1 right before we came here,
I
so.
was coming on my way here, passed by some.
Yeah, that was, we had one over at Mobile Lane.
Yeah.
So didn't turn out to be anything, so there we are.
Thank you.
You have a copy?
Yeah, but they were sending your emails and but
No, it's not, so we got an electronic version.
yeah. Yeah, yeah, I know. You know what Tom's read also.
Yes.
Yeah. Yeah, I mean, we're not doing the fire department stuff. Yeah. Okay, So anyway, so now back to the, I guess the town departments, they all presented, but we need to talk about the health insurance bit and also the chart. The Christina.
Yeah.
Discuss.
Go to the schedule.
Yeah, and then the schedule.
Well, here's 2025. And then here's 2025. You just don't write batch. So just as a, it's a attractive batch.
So just, did everybody get the email I sent this morning with the tax rate worksheet that Jason showed on Tuesday night?
Yes.
So the big key is just use the blue box, you can change, that's.
Don't touch anything else or you break that.
Well,
Yeah.
yeah, you could, I mean, it won't work as well.
Don't customize it. Just the blue box.
Yeah, and there is information on the bottom of that about our fund balances and the four main funds. And please note that there are 3 tabs. There's a tab for the 4 main funds, there's a tab for the fire department fund, and a tab for the ambulance, because those have different tax-based tax rates. So I just want to make sure,
I guess at the end, I can show that if you.
it's up to you. I just want to make sure everybody had it. That was my main point, to just make sure you had it for any questions, if you had questions on it also, because we did talk about it the other night.
We do the health insurance part first. Just because that.
You want me to summarize a little bit, or do you read it and kind of understands it, or do you question?
Well, some ads and but I know it's like the basically choice, the 2 choices are the. Like platinum versus same, but.
So basically, our current policy is, we offer 2 plans. A PPO plan, which has a high premium, monthly premium, but lower out-of-pocket copays. And we offer the platinum plan, which has a lower monthly premium, but has higher copays. But along with that, the platinum plan, all employees that enroll in the platinum plan are enrolled in a health reimbursement account that can pay for those copays up to either their individual or family level. And the contribution by the employees is either 0% if they were employed before 2010 and 10% after that, or for any employees after 2010. And as Mike mentioned, we have seen health insurance across the board, not just in the consortium, has skyrocketed. We had a 14% increase in the premiums last year. We have an 18% increase this year. I wouldn't be surprised if we see another double digit next year, because of just the catching up in the cost of the pharmacies. So basically, we presented to the board, did they want to consider making changes to help with the cost to the taxpayers? Because obviously, if the employees are only contributing 10% or nothing, then that means the town is paying the rest of that amount of that health insurance. So one of the spreadsheets one of the worksheets I sent you shows, here's what it currently costs. And when it goes to 2026, what it would cost if we make no changes. If we keep the policy just as is, if you new employees enroll in platinum, if you want to stay in the PPO, you can. This is what's going to increase for the health insurance. I should note too that these changes will only affect the A fund and the B fund, because all the union employees in the DA and DB are under their contracts, and we can't change those for 2026. So I have a note there. It's based on an overall increase from 25 to 26 of 71,241 if we make no changes whatsoever. One idea was, what if we said all employees would now contribute 15%, and they can still have their choice of the PPO plan or the platinum plan. That way they can keep if they want to keep that lower copay or other reasons. The coverage is pretty much the same, it's the copays is the difference. If we ask tell employees that the change will be 15% in 2026, it only increases the cost of the town by $44,626. The other option is we say to all employees, you can continue to contribute only 0% or 10%, but all employees must move to the platinum plan and still have the health reimbursement account. By switching to that plan,
the overall cost for the A and the B fund would only increase from 2025 to 2026 by $11,612. So because the platinum plan has a lower premium, so that's where the difference is. So employees would have less withheld, the town would pay less. But the employees need to remember, if I'm having less withheld, I should put money away in a savings account if I go over my deductible. Or if I go over what will be reimbursed, a health reimbursement account. So it's just it's that understanding of how employees use their health insurance. You know, there's co-pays. Do you have not premiums, pharmacy? Like, do you have a prescription that you have to get filled, and what's the copay on that? And being aware of that, and are you or a family member going through a medical situation that needs extra care? You know, how do you look at that? And so it's important that each employee would have to look at that situation. But again, if you have a much lower premium, then that's more money in your pocket that then should be going into a savings account for future costs if needed. So that is the health insurance options that we talked about.
What percentage of our employees use PPO versus platinum?
So if you go through here, 1, 2, 3, 4, 5, 6, 7, 8, 9. And then 1, 2, 3, 4, 5, 6, 7, 8, 9. So about 50-50.
This is all our employees right here.
Yes,
Yeah.
this is our employees. Except again, not including any union employees.
Yeah.
The key here is any new employee after 2023 had to go to the platinum plan. We put in, when we adopted the platinum plan, we said the town hall employees, non-union employees could not enroll in the PPO plan. The thought was one, to give employees a choice, but number 2, to start moving the town to a lower cost health insurance. So some employees did choose to switch automatically. I was one of them because I thought it was a great deal. But some said, no, I'm not interested. I want to keep the plan. I know what my coverage is, you know, so I respect that. And I said, okay, well, you have a choice and that's fine. And the town was willing to give them the choice.
Is there any impact to provider choices or network?
No, it's the same, it's the same Celus network. There's no change in doctors, there's no change in pharmacies. The key will be the copays. For example, the current plan, if you go to the emergency room, I believe it's a $35 copay. The new plan, the platinum plan, is a $250 copay. Now, emergency room is necessary. Don't get me wrong, I've used it with my kids. But it's trying to encourage users to actually go use urgent care. That has a $35 copay compared to a $250 copay. So that's where the big difference is in the amount of copays.
If there is no copay.
No, pretty much everything has a copay now.
Yeah.
Even generic pharmacy has at least a $5 to $10 copay.
Yeah.
So there is still minor copays pretty much on everything, and that's just
PPO plan.
even, yes, there's small amounts even on PPO.
That's no premium.
Yes. But higher premium because it's when you're getting into some of the specialty drugs, that's when you see higher costs. So no, there's still copays even on the PPO plan. It's just different. It's lower than what the platinum plan is.
How much the town will save if we move all employees, to the platinum?
That's that last column, it would be 11,612. And I should note that when I have in here is the health reimbursement account, the HRA, that is money that the town holds. The employees use it, they use it. But if they don't use it, the town keeps it. So that actually could even be less because employees might not use their full copay, the full amount of their allotted health reimbursement account. To give you an example, my family, the family plan is $3,000 a year. I have 3 college students, teenagers, and a husband. We've spent almost 2,000 of that. Well, that remaining 1,000, as of right now, still belongs to the town. So that's still cost savings to the town because still money for next, help. Now, it doesn't roll over. I don't suddenly have 4,000 for my family next year. It's still 3,000 at the beginning of the year. So you have 3,000 allotted or 1,000 for an individual plan.
What is the feedback from staff as far as the ease of use of that? Is it owners, do they not request the rebates because they don't want to even necessarily show?
They actually get a debit card.
Okay,
You get a debit card and you pay just like you would, at the pharmacy, if you're paying a copay for your prescription, you swipe it, it pays it. The only thing I've had to do is deal with, I accidentally paid with my personal debit card and had to request reimbursement. And you have to send receipts. And then they put the money back in your bank account. So it's a very simple. The key is always keep your receipts because they can't ask for verification. You're like, hey, that doesn't make sense. It doesn't cover any over the counter, like if you're buying Tylenol or Band-Aids or cold medicine. We don't cover any of those, just for ease of processing. So I don't handle anything. I don't see anything other than making the journal entries in our accounting system.
I believe all county employees are under the platinum choice at the moment, right? The county switched a couple of years ago.
Yeah.
All employees.
Many of the consortium members have moved to the platinum plan.
Right.
Some slow, some in pieces like we are, some automatically, any new members usually pick that one.
Right.
There are other plans, but I'm not suggesting we look at other plans right now. I think this is the most in between what we have, the old one that we have, and the other extremes that are much less in premium, but much higher out of pocket.
So when you say, and on this sheet, second to the last column on the right, you're talking about a monthly premium cost you have, is that correct?
I'm sorry, I'm gonna
Just
just
change all employees to a 50% cost share in 2026.
yes. So I'm saying
That
instead
means there would be monthly premium.
there would be a monthly withholding. So basically they have withholding from their paycheck. For their share, the 15% of premium. Instead of 10. Instead of 10. That's one of the options.
Right, so that's the premium, that's their portion of the premium.
Yes.
Yeah,
Yes.
and what the chart says, if we did that, then people can have, that's the option where everybody has the choice between, but.
And
Hopefully,
PPO,
the employees paid prior to,
The PPO plan.
2023.
So by continuing to allow employees to have a choice of plans. This was an option to say, let's just switch everybody to 15% and give them the choice.
Is the copay for regular doctor's visits or like specialists, is that $35 too?
No, without going and looking at the details, I believe it's $20 to $25 for your regular doctors. And again, if you're going for preventative care, annual physicals, flu shots, mammograms, those are all 100% covered.
right.
It's the important part.
Right, that's basically they're trying to encourage you to go get those regular.
So the HRA, is that a deduction from paycheck too, or?
No, because it's fully funded by town funds. It is not, that reported on their W-2, it's not added to their earnings. Because officially it's a benefit, but it's a non-taxable benefit. And because they're not getting all of it unless they use it, it's no taxable benefit to the employee.
Does every employee get that?
If they enroll in the platinum plan, they get it.
Yes.
That's the key. If you're in the PPO plan, you can't be on it.
So what's the perk to be in the PPO?
Lower copays.
But you can use your debit card for your copays.
You can't have an HRA if you're on the PPO.
Yeah, there is no,
Or if you switch,
If you switch,
then you can pay your
Yeah.
copays with that, and in theory, you may pay no copays all year if you're using your card.
yes.
So there's no
We also have to
downside.
say the health reimbursement account will also cover dental and vision out of pocket.
right.
That doesn't add to your medical deductible counting, But it does, if you're paying with cash, it's,
So why would anyone want PPO?
I think, I would say comfort. We know that, I know what my plan covers, I know what it costs. I don't wanna change. And that's my initial thought is, it's the comfort level, it's my healthcare, I know what's happening. And so I think it's gonna take some education.
It's less complicated.
Yeah, it's gonna take some education. Darian, feel free to pipe up on it, so. No. Yeah, I mean, I think it's gonna take some education for people to understand, here's the change, here's the benefits, you know, from it.
It's kind of a feeling.
Yeah, I mean, here's why we're doing it. I mean, it's a, you know, instead of, each employee, if you switch the platinum, would see less money coming out of their bank, out of their paycheck, because they're gonna be paying less in premiums. But they have to remember, they could have more to pay out of pocket later. So that's just, you have to be. Encourage employees to think like that, they go, hey, that $15 a paycheck that I'm no longer having withheld. I should be dumping that someplace safe just to have for medical, because medical can hit you. Suddenly, and you can have massive medical bills.
But are any of those copays so big, such a huge difference where one is $35 and the other one's 10,000?
No.
Okay.
The other key is for the deductible and the platinum in 2026 for a family, it'll be $9,000. For an individual, it will be 2 or 3,000. I think it's 3,000. So again, once you hit the deductible, then you're 100% covered.
Yeah.
But you're gonna have so much out of pocket,
Yeah.
that you have to get to that number. So you gotta have a lot of expenses. Because again, you're having copays. Like, how many times would you have to go to the emergency room to get to that number? I mean, there's a lot, because you usually have many other things that go to the emergency room, but after that.
Yeah, it's if you're having a major surgery, you get to it pretty quick.
You can, I mean, if you had needed MRIs and CAT scan, you know, it can happen.
But it really never, you know, amount to use up all your what is the name of the day? I mean, I know because my wife has the platinum, and she has a bunch of different things going on all the time, including this, you know, the use of high technology for some of the tests and so forth. And she never ran out of the money.
Okay, yeah.
So
If all employees switch to platinum, does that mean all the employees will be paid 90% or would still, or I mean, would some still be at that 100%?
My suggestion here was to leave them at the 100, leave them at the 100%. There's only 1, 2, 3, still 3 at rate, right? 4, excuse me, 4 at 100%. I forgot the one. There's only 4. And kindly said, some of them are thinking about retirement in 5 years. Right. You know, like, so it's not a forever.
Yeah.
Because of that. So I guess I was like, let's not change that piece, let's just change one. Like, I was trying to, that's how I was thinking about it.
Yeah.
Let's change one, not both.
So the township would say no.
Or 100% depending on the employee.
And new hires would be at 90?
Yes.
I think moving to the platinum makes sense, because then it also leaves, if you're gonna be talking about. The salary changes, it helps with that too.
What are the highway for them? Platinum?
I would say a majority, vast majority. All still on the PPO.
Okay.
They, when I presented to them, they were not excited about it at all.
But if everybody else switches to platinum, it might be an easier.
It'll be up for discussion during union negotiations, so I can't really predict that.
yeah,
Do you happen to know how closely this tracks what the state offers, state employees?
So if you work for the state, how much, what it would be?
What the options are and
I don't know. I don't know anything. I don't know any like state benefit plan. And I would suspect the only thing I can say is, in our research, I could find, the town of Lansing personnel manual and what they've done. They've moved everybody to the platinum plan. Well, let me rephrase that. They didn't move everybody. They allowed those that had been employed before 2016 stay on the PPO plan, but everybody else had to go to the platinum plan, all new employees after that. I think it was 16 or 19. But they are at a 15% employee share. But I couldn't find any other towns. I can say nobody is at a 0%.
Yeah, one of the only ones doing that. Folks have been around for a while.
Mhm.
You got the 10%, I could be. The only one doing that.
We might be, but I don't,
I don't think we even like, I don't. I believe Ithaca is 20.
I wouldn't be surprised. City of Ithaca, town of Ithaca.
Yeah, town of Ithaca, I don't know what the city does.
The town of Ithaca is at 15. It's still in their personnel manual. The city could be something else.
City can be different because they have a union.
Yeah.
Structure.
And they have also multiple plans, different plans, so.
So our benefits are margin.
Yeah, like our benefit is more, like the health benefit, more generous financially, yeah.
Yeah, and not, in those that have platinum don't offer, like town of Ithaca requires the platinum, but does not offer a health reimbursement.
Right. Yeah.
I think they offer a flexible spending account, but that's a choice of the employee.
That's where like Cornell does something like that, that's where you have to designate a medal. But it's your.
It's your.
It's your money, and then, you know, news are all, you still don't get a medal.
Yeah.
Which is just.
Yeah, plans, I don't think are a good deal.
Cap and you pay taxes on it or something. They don't just keep it.
We've never gotten it.
Yeah, you have to use flexible spending, you have to use it up. Unless the rules are changed. Yeah.
That's where it all comes from.
It's not just essays, HSAs, FSAs.
Yeah, they're all.
CRAs, they all have their rules, so it's
Yeah.
a myriad of information.
Hey, Jason?
Yeah.
Jason, I just, I switched to the, other plan back when Amanda came out with it. And I talked to some of the guys, and obviously, most of them were not a chance, no way. And one of the questions was, obviously, it sounds great that, you know, if you have this little extra $15 in your paycheck or whatever, you're gonna put it in a savings account. Well, I know me when I was, you know, 25 to 40 years old, nothing was gonna be wrong with me. I'm gonna be healthy forever. I'm not saving that money. And the other question was, they felt, and I don't know how that actually works, but if you pay your premium, you know, you pay a premium all year and you get, I think, Amanda said $3,000 for a copay if you need it. Now, obviously, the older we get, the more we're like, well, if we don't use it, why wouldn't that roll over in my account if I don't use that? You know what I'm saying? I think that would make people feel more comfortable that if I only spent 500 of my deductible that year, next year I have 5,500 to put towards my deductible. And I don't believe that they should ever do as a payout. But until you retire or get better benefits, I think that they were looking to see if that would roll over.
Then you have to pay taxes on it or something.
Yeah, so unfortunately, Rick, that is not it's a federal law. It's not something that I can make or we can make.
Okay, yeah, that was some of the questions that were brought to me when I tried, when we talked a couple years ago, I tried to get them to switch over. They were pretty dead set against it, so I'm just trying to think of options that would help to get them to switch over.
Yeah, thank you, Rick. I appreciate the feedback. Unfortunately, it's nothing that we can change. It's the rules of the federal rules of that plan. And so that's what makes it challenging, is to be able to, and so I understand it's hard to get people to save money when they're like, I'm fine, why am I gonna need that later? But I mean, I think there's enough employees that have had medical issues that can go, oh yeah, it wasn't fun when I suddenly had to, you know, was past my, you know, one amount and now I had to pay my out of pocket. And I mean, I had that happen in my own family where I had a year with a kid with a broken arm, a kid with stomach issue, and lots of tests in between. And we hit the deductible that year.
Do we offer flexible savings accounts?
No, we don't. We only offer this HRA. There was never a flexible savings account before this because the co-pays were so low. That didn't, where's the value? I mean, some families it would have been valuable, but some it wouldn't.
Now we would not.
Only if they, only
So
for
platinum plan only, we'd have HRA.
Yes.
And they dedicate 5% of it.
They actually don't put any money in.
They don't commend me, yeah, that's the
It's
thing.
all town funded.
Yeah.
It's
So the other question was, they say that there's the same plans that other townships have offer a larger copay or 3,000, whatever. It's more than that than what this is. Is that something that also is true?
can you kind of rephrase that? I guess I didn't quite understand the question, Rick.
So right now, when I switched, I got a, $3,000 to use for copay. And I was told that there are other towns that offer a larger copay. Is that like a different plan or just, how's that work?
So you're saying that the health reimbursement account could have had more in it? Is that what you're saying? More than the 3,000 for a family?
Right, I think that the town of Ithaca was 5,000, I'm not positive.
So that's a tough question without going with the town of Ithaca's rules. They don't offer a health reimbursement account. They only offer a flexible savings account. And that's money that the employee would put in and probably maxes out at $5,000 is what I believe could be what that.
Okay, fair enough, all right.
Use it or something.
Well, I'll let you get back to what you're doing,
Okay, well, thank you for your input, Rick. I do appreciate it.
Yeah, I mean, I think an HRA is a better deal than FSA, sure.
Is the 3,000 HRA, is that for family or single?
That's family. It's 1,000 for an individual.
Oh, okay,
Yeah, because their deductible is lower.
got it.
So.
Combining.
So no, it's not income, so.
Yeah.
Stuff, it's an extra, it's like having an extra.
It's like a supplemental,
Yeah, so it's fully, it's tax free, so if they're using it for their co-pays, they're not, but they have been saying it's pre-tax, but then if you don't use it all, you don't get the extra.
But it does nothing to incentivize what you were talking about earlier, in terms of going to urgent care versus.
No, it's still giving the employee the dependents and the employee the choice of where they're gonna go. But it's also saying, if you use up your allotment, whatever it might be, it might make you second guess, like, hey, maybe I don't want to go to the ER just because I have a really bad cold and probably have tonsillitis or have bronchitis. I need antibiotics. I'll go to urgent care. Or there's no copay if I do telehealth. There's no copay at all. I can do it right when I'm sitting here and the doctor can look and go, yep, you got an ear infection, or your kid has bronchitis, or let me call in your prescription. There's even telehealth. That's no copay at all.
But how is that incentivized that it's December and you've got $4,000 left in your HR?
Well, there's no there's no way to incentivize it unless you've used up your HRA.
Right.
So that's a case of if you used it up, then and you get to December, well, that's been out of pocket, and that might make you think about it. I think again, it's just education to the employees and their and the dependents on the plan to say, be aware, hey, if you do telehealth, there's no cost.
Yep.
Or hey, if you need to go someplace on a Saturday because you are super sick, check out urgent care before you go to the emergency room.
Yeah.
And that just takes time.
Depending on the
Some of the
circumstances.
options that the state offers, I just know what I've got, and it's, co-pays, but we have an FSA. And so we can set that up to cover
Yeah.
co-pays. But it creates a little bit of a market mentality in the customer orientation.
Yeah.
So you don't. So you can use more affordable care.
Yeah.
And you can economize a bit. And we don't incentivize that in the way this is set up.
Yeah, because you gotta remember the FSA is coming out of your paycheck, so it's your money
Right.
going there, so it's your money. In this case, there is no incentivize other than it has a limit, it has a cap.
Right, yeah, and the thing with the FSA is you can choose the number you put in, so you're beginning of the year guessing anyhow, like what may I use?
Yeah.
Which is like, I know for,
Yeah, it's true.
you can be wrong, then you're out of luck.
Yeah, or you can't get into the doctor, or can't get into the dentist, let's just pretend, like, if you had a dental appointment that you thought you were gonna get in December, it gets canceled, and that was what you were gonna use the last year FSA on,
Yeah.
that means you're out of luck, you can't spend it.
But the other thing is when it's your money going into it, you don't get it back, then you're. You're basically, your incentive is to use more care, I think, than which now with an HSA, which is, I know I have a limit if I go above it. Or
That is true.
FSA, I mean, the FSA, I think lets you apply it towards more things.
Mhm.
And roll it over. For
Yes, yeah.
Once a year.
Yeah, it's
Sort of sad, but
it's hard,
I've
but
had them for decades and. Never been burned, but it
yeah.
never lost money.
It's,
I
it,
get new glasses with them.
Well, yeah, but that's the thing, is like, you might, it's like the kids, like if you go away to school and you have like food plan and someone buys like 50 dinners of plastics and use her. That's what it kind of feels like, that's why, like with HSA, you know, if you know you're coming up to your limit.
So we put this out mainly because we've been watching expenses cost go up so drastically and wanted to provide the town with. The town board want to consider doing something different for 2026.
I like the last option.
The platinum
Yes.
You better on the platinum.
Yeah, and keep the,
thing, and, you know,
And then keep the percentages the same.
Yeah.
like you said, not too many changes at once.
I mean, I think it's recognizing our employees, recognizing their dedication to the town. Saying, we're still willing to pay your 90% of your premium. But we're at, we need you to move to a different plan, a plan that still has. Good coverage. And, here's the benefit, it's gonna be, it's gonna take some education. Probably will have some grumbles. But
but we don't offer an FSA for the PPO folks. So-
no, we do not.
So they're gonna actually potentially.
They could be, yes.
Could be, just depends how often they're going to.
Right, it depends on everybody's individual medical situation. And the key is the Health and Consortium will, the benefit specialist, she will meet with individuals and say, hey, this is what you used last year, so you can see it from Excelis, and this is what it cost you. And now, if you do the same thing next year, this is what it could, this is what it will be different. So she will meet with them individually and look at them individually, because obviously I don't want to know and I can't see how people use the health insurance plan. For very good reason.
But that's something that you guys will allow them to have that meeting on.
Yes, like we can offer and say, if you are concerned at the cost, please meet with her. She will go through each one, each line, or each of your common uses, whether it's prescription or other care that is getting done. And she
We
will,
can set up a presentation too, right?
yeah, I mean, she will do a presentation to the whole all
Yeah.
employees that are interested. The benefit specialist at Consortium is extremely helpful and knowledgeable.
Right.
Excellent, okay,
So I would probably, yes,
that makes a big difference.
yeah, just needs to be able to say, hey, meet with her, talk to her, see, like, she'll meet with you, like, on your schedule. And have that conversation.
So do we need to adopt that how do we move from here?
I think we need to have a resolution.
I suspect we need to have a resolution. I didn't write one up because I didn't know how far this would go tonight. But if we can, that'd be great, because as soon as I get back, I will need to start open enrollment documents
Right.
with all of this information in there to the non-union employees.
And then I'll just move that we move the employee, this is just for the non-union employees to the platinum plan with the HRA as we have described in this, in the
I second that.
chart prepared by Amanda. Yes.
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 Thank you for that answer, because that will.
Right, the difference, I mean, just as a scratch, it's roughly 59,000, which could then be, available for upstep. So the next discussion will be the, proposed, chart and structure, I guess, of it.
It's so confusing.
I just screen noticed that some of the 2025 salaries didn't line up with the 2025. Here,
It's most likely a case of I have to do adjusting journal entries at the beginning of every year to account for accrued payroll, meaning time worked in the prior year. Our budget is based on, when we do the budget, we say, well, this is what someone would earn, and we base the hourly rate there.
Yeah.
So the difference there is most likely, I took everybody's hourly rate right out of the payroll, current hourly rate right out of the payroll system, and did the multiplication depending on 35 hours or 40 hours.
Okay.
So most likely that's why you're seeing that difference.
Yeah, it's not big, but I was just like, just
Yeah.
because I
that were, yeah.
Yeah,
wanted to make sure we.
yeah, so that is, I'm 90% positive that, because I know when I did this, I took their hourly rate, you can see it right there, like, here's the hourly rate, here's the normal hours per week, here's what their annual salary would be.
So would that mean that these percentages might not be correct?
They're not only gonna be, because it's so minor, that accrued payroll is like 5 days usually, of time, like, basically I would have had to adjust.
So that less than 1%.
Yeah,
probably.
it's very, very minor amounts. Yeah. So yes, there was the pay schedule that we are suggesting or recommending, the personnel committee is recommending. Was a separate sheet to say, here's what could be different, here's what the difference would be. And this is taking the proposed hourly rate at the step that those employees are at and what it would do to the budget. So that is in there for that. There are some that are large differences, and there are some that are minor differences. All depended on the position and where the adjustments were happening. So,
So what we're talking about is creating a step system.
yes.
And higher rates.
Yeah, but
Yeah, because when I dug, I a few minutes. I actually think the last time this was talked about in town, right? Ed Lyons was when Mary Ann was supervisor, they found an Excel sheet from 2014 with higher rate, and it was based on, I think, the way the county did it. So it's on the supervisor server under budget finance personnel. It's there, we can go to that too, but it's not as detailed as what you all like, Christina put together.
Well, I just noticed, I mean, the short time I've been on the board, 3 years, we've had to hire 2 planners, a deputy town clerk, two court clerks, and it's like every single time the process is different, and if we had higher rates, that would never have to happen because the department head would know, hey, this is what that person's gonna start at. This is what they're gonna be making 5 years from now.
so I'm not trying to be difficult, but I struggle with I struggle with the 1 to 3 years, 4 to 6, 7 to 9, and 10 or more. And let me explain why, so that I'm not speaking about. One is 2 things. One is it's not necessarily, it doesn't necessarily equal years of experience. So we may hire someone in who's 50 years old and has 30 years experience as an expert. Are they really gonna want to come here if they're getting hired in at like the 1-0 experience employee salary rate? The other question, and which I think just expands on that, is that because you did a ton of work, so I don't want to poo-poo all the effort that I did. but the other one is that there's so much research out there that, that the younger the employees are coming in, the less time they're gonna stay there. That part of what we have to learn to adjust to is that we're going to see employees coming and going at a faster rate. People are moving around the country more, their lives are changing more, it's a new culture that's not the one I'm used to. But it's a reality there, and but I do get concerned about the concept of maybe having people missing out on highly qualified people because we're saying that they're gonna get hired at the junior salary rate. So
One of the things as we're developing this, when I was researching Lansing and because we use Lansing and Ithaca because I know the people, I know the HR personnel people in there, and also they're what we thought were close to size and similar services, not the same, where none of us are the same. One of the things Ithaca had was if there's a situation of experience coming from another municipality, has 10 years of experience, they can come in at a higher step, but there'll be a process we'll need to set up. So that's kind of a continuation of this is going to be putting in, because at the same time, what if we say I have one employee going from one job title to another job title and they already have all this experience, why should they come back in at the new higher rate? So there's going to be something set up to say they're going to, hire from within from another job title would be able to come in at a different level, not a new higher rate. I understand that the employee, like the younger employees are not likely to stay. That's true. I guess we're trying to incentivize or trying to provide as an employer of we want our employees to stay. We cannot, and not knowing that life still happens. Spouses get different jobs in another state, or they find the perfect house 2 counties over. We all know that happens. But if we have a situation where I have an employee that is dedicated and knowledgeable, if we can provide a workplace that encourages them to stay, then we are ahead, because to hire a new person in takes 6 months sometimes to get them up to speed or longer. And so that's basically the thought process. I am not married to the 1 to 3 to 4 to 6. I was mainly part of that was I followed one other town's process. It also means there's less payroll work for the changes. If we do a step every year, it's a lot of paying attention to what step is that person on. There will be a longevity policy to go into place after 10 years, because obviously there'll be no more step increases, but then there'll be a longevity pay, which is the same as our union step.
So does this replace? I'm not, and again, I'm understanding.
Ask questions.
So is the intention here is that people's raises, there's no merit raises, it's just based on years of service?
That's correct.
Currently, you have to do the reviews.
I'm still encouraging department heads to do reviews for numerous reasons. Won't waste your time. But we've had them. But interestingly, we had one situation, one time I had an employee who didn't meet expectations. They did a second review 6 months later and increased them. It happened one time in my 4 years since we implemented it. And my experience has been, our town has so many projects going on. Every employee here is putting in that and then some. We don't really have any fluff at all in our staff. Our staff step up, take on the next thing. This new project is coming, so we gotta learn this. Or this new grant came through, we need to process this. Or, there's new rules from the state and we have to do this. Each one of our employees, you should be very proud. You have an amazing, amazing staff here. And so they have all stepped up and done the next thing. There is probably gonna come a time we'll have to hire a new employee. And then we'll have to, you know, renew this again and adjust it. So yes, we have done merit in terms of, and that's what it's been the past few years. And that's valuable, but at the same time, it's not as encouraging because department heads can still say, well, I like that, but I want my staff to have more.
Yeah.
And so it always ends up being kind of this continuing grade.
Because we've never followed it. The way
We-
we're supposed to do it. So let me, we have not followed it. And we come budget time and department heads or judges come in and say, that's all good and well, but I want this.
Right.
And we as a board relinquish our authority. And so it has been frustrating to watch what was a very thought out system to reward and recognize CPI, cost of living, while incentivizing merit-based pay and manager involvement in developing employees and improving that relationship, because performance reviews are very, very important.
Right.
And I'm not convinced we do that here to the extent that it needs to be done.
Okay, well, I appreciate that, and you and I worked on that merit base, and we tried to look that forward, and it was interesting to me, and I was new that I didn't have a lot of experience to go and say, oh yeah, that'll work, and then 2 years in, I said, wow, this is so hard, because we still have department heads that want more. By putting this system into place, it means that every year at budget time, really, the department heads won't have a say in their salary lines. It'll be myself and payroll clerk going, here's your salary line for your new staff with their step increases in COLA.
And they can budget years ahead.
And yes, you can plan budget years ahead. It's going to mean instead of having jumps, off and on jumps, we're going to have a steady increase, because it's all going to be, and again, it's going to change, because if we have somebody retire and we have a new hire come in, well, that's going to make a dip, but that's fine. That's part of.
Well, that part's been tough too. Bring someone new in, it's like, you're. If you bring them in higher than someone who's been here, it's friction, and this is good.
Yeah.
The thing is, like, what I put up there is what the years part, or the union contract, current union contract
Yeah,
has.
we see that. before.
So you can see 0 to 6, 6 to 1, 1 to 5,
Yeah.
5 to 10, 15, 6 plus. That's how the union contract's written, so.
I think we forgot to, I don't know if you mentioned in your original email that they'll bring the wage line up too. And we realized a couple of our employees were below the living wage.
So that was part of it.
So where did this structure come from?
The structure actually, it's a combination of Lansing and Ithaca's. It's closer to Lansing than Ithaca. Ithaca had a 1-year step increase and then in longevity after 5 years. And I just found that was going to be a lot more work. I thought it would be.
Yeah.
So Lansing actually just redid theirs and passed it in August. So theirs is fresh and new this year. And I think, so I felt good about, this isn't, they just revamped theirs, worked on theirs earlier in the summer. Their personnel committee.
Yeah, and I think we just picked something so we could see what it would look like. And
Yes.
Tweak it.
Yes, and then we tweaked it and said, okay, well, here's our staff. And, I tried to put information in there of like, okay, so it would be informational to you. So you can understand some of them.
So I followed that what you guys are proposing is like some of these jumps are massive.
Yes.
Is that it's to level set them based on Lansing and Ithaca salaries, is that?
And salaries, you have descriptions and functions, right?
Yeah, so we basically were looking at if we had a same job title between the towns. How can, so if we have staff, and we've had staff that left because they could be paid more for the same job. And so we said, okay, how can we be?
Who you're referring to?
There were 3 individuals. We had Taylor, we had Emily, thankfully, Emily and Shelley.
And how many years?
And 5.
But
Yeah,
Yes.
that's, yeah.
Those
So-
long, been in the last 3 weeks I've been here.
Yeah, but, sorry, but is it, you averaged is it kind of Lansing salaries and then took the average, or?
No, we basically said that's close. And pretty much almost in all cases, we're still below them, and that's in one of those other documents.
Yeah, I just know Ithaca is so much higher
Yeah.
than,
Yes,
even
so
Lansing.
we weren't trying to meet, to be like right at them. We knew that was not realistic. But at the same time, we knew we should be reasonable. You know, as I mentioned, we didn't include Portlandville because they didn't have a similar way to match. And they were a lot of times under on the average. So I felt like, well, we're kind of in the middle. We're not trying to be the top rank, but we're trying to at least be, you know, similar. Yeah, competitive to other similar positions in other towns.
I pointed out that that's a pretty small sample. It goes to municipalities and not look at a broader, we're gonna start comparison process and making a study this. You know, the development to, and that was one of the outcomes of 2-year study I did with. Do this for a living, and a lot. And picking out 1 or 2 municipalities. But it's not statistically sound, doesn't happen.
It's true. I guess I was looking at time. I was looking at how much time do I have? Who can I reach out to? And also the thought process is if I have an employee living in this area, Tompkins County area, and they were going to a similar job, what would they go to? And I couldn't think of any other towns with similar services size, other than if they're Lansing and Portlandville. And if Portlandville had a great, something similar to give us comparisons, I would have used them.
And I would like to see that.
I could, it was a handwritten, not handwritten, it was basically a list of rates, employees' current salaries and how many years they've been there. That's all that's all they had. They're very interested in.
The thing I learned in this process is chasing down the data to make this assumptions.
It's
Before we chased down, I think 5 in the study I did. But seems like an ILR, but.
We were trying to our town.
The other thing that, you know, I think these comparisons is. What your tax base is, if you've got a municipality that has a shopping mall, a power plant, or expensive homes, and no ambulance service. And you got a municipality with a lot more. And I think.
So all the municipalities are different.
When you start making these comparisons, that we should be doing what they're doing. That ignores, you know, what our fiscal reality is in terms of our expenses. If it does not have an ambulance service, Lansing does not have an ambulance service. So they're bringing in more and they're spending less.
what we were saying.
Yeah, Leah.
The comment is that, firstly, you know, the tax base of each of these towns are going to be different. You can, compare, you can say that the tax base will be the same for each of them in order to make changes that somewhat, make the process of or advancing the pay of our employees in a more rational way. That's first. The second is that in a town that is in, rapid development, rapid growth. Yes, we are. We just added a huge project which is driving fiber, which the other municipalities doesn't have. So the question is, for me is how do we in a town that is rapidly growing, that is adding projects that are contained in a future when we have just carrying the reach over 2,000 more people in the next 10 years. So how do we accomplish, the task as a town in a way that to stay when I can for the type of, or experience and the type of specialty that we need in order to do our job here.
We want them to work here and live here.
And we want to keep one thing competitive, otherwise we are going to miss out. If our panel, in the next year or so, the starting point for that extremely high, higher than we are doing it today. And you can similar sort of special kind of experiences and so forth, and we'll have the same issue. It's not rational just to just.
We lost population in the last census, we lost population in the last community survey. No. Anticipate growth, then that's what.
We're not anticipating growth. We have candidates on scenes.
Okay, here's the thing, we have jobs that need to be done, and that's what we're paying people to do, it's not necessarily based on population, it can't be. Because the jobs, who's gonna do the work around the people, because we're not coming in here and doing the plan, that is, yeah, so what we're competing for is the town. And as far as like, I mean, county websites, they changed something, but like as far as like large taxpayers, like this town has 48% of the utility infrastructure in the county.
Yeah.
And that includes Lansing, so that you know that old plan is not 48%, it's not 52%.
Well, one thing I was just looking at here is the US Bureau of Labor Statistics. That does publish salary averages based on job type, including government work. I just looked up the rec for kicks and giggles. And see that what you guys put in is just about, for him, nails what came up for the in the US Bureau of Labor Statistics salary. So I don't know if there's value in cross-referencing to give a broader data. Dan, you brought up the data, minimum data points.
That's for the non-salary number.
But this will give us a national swath data. I mean,
Yes, but
thousands of jobs.
You can get even more regional, but indeed.
Yeah.
You can look at a given part of the country or state and look at, what a town clerk gets paid and what a recreation director gets paid.
Would you be more comfortable with this methodology if we were using more data points to that effect?
Absolutely, that's been my complaint about this and my complaint about when I went through this a few years ago. It's a difficulty of finding this, and what we resolved is it's a fool's errand to try and find comparable data. You just gotta do what's right for your town, set your salaries, set a reward system or employee retention.
That's exactly the way we're moving it.
Dennis, let's not turn this into an argument. And have a system that's consistently applied and understood by all staff, and I don't think we ever got that. With what was laid out and presented to the town.
But I think there's two questions, there's two parts of this. One is setting up this structure and then the other is the numbers you plug in. So it seems like to me. Your focus is really on the numbers to plug in. But we need the structure to resolve this year-to-year issue that we have with the department heads and all that. So I would say, why don't we adopt the structure and then work on, while we're working on the budget. The numbers for pay, but also some of this is also, like we've been talking for years about pay equalization things. To get them people, because there are people doing jobs here that are the same job functions in some of these other towns that are nearby. And they're being paid far less. Now they're choosing to stay, yeah, and it could be because of the healthcare part, but that's part of their total compensation. So when we're coming up with these. Yeah, some of it's home too, and the thing is, like, I know from. looking at towns that aren't anywhere near us also isn't productive, because unless someone's willing to move to this county or drive an hour from outside to come work in the town, well, it's not realistic to look at something like the people of Broome County even, because they're not gonna come here. Well, I really don't think so.
That's where I'm standing.
Residents.
Yeah. Right, so many, especially in residency requirements.
Or elected.
No, but for the deputy has to be in as well. So,
I think-
so if you have a job like that and,
I think that's it.
so.
Okay, so. Again, you said my concerns, my concern was the loss of. Funds for the development, I mean, rewarding like merit-based increases, that's one of my concerns. We also do not take into account inflation, so if we have a bad CPI one year, this region structure becomes common.
Okay, so a couple things. I am so, as my HR hat is on, I will still be highly encouraging performance reviews. They are great for staff to know, to understand like what they want to do, where they want to go. It tells the department head what they want to do. And honestly, too, it gives structure if there's a problem employee. If we have a problem with an employee because civil service limits us or is very strict about how, if we want to remove an employee and they don't resign, if we want to have a reason to fire an employee, civil service requires us to have quite a list of things. So I am still going to highly encourage and send out performance reviews for all department heads and for all staff. Because it's a great conversation tool between a department head and their employee. Of here's, employee says, hey, I really want to learn about this tractor. Or the department head says, hey, we really have this need for someone to learn Adobe fill-in pages. I'm just throwing that out there. Hey, I want to learn that. That sounds great. So in terms of the performance reviews, they are still going to be encouraged and highly recommended. I can't say required because it's kind of a hard thing to require. In terms of the merit base, yes, we're taking that out because then it becomes a case of you stay, you do well, you continue to do your job, you get the step increase, you stay 10 years, then you're having longevity payments. But in the last statement, I want to say is this will get updated every year for CPI. We will take this and adjust the starting rates by CPI. So all employees will have a CPI increase every year because the rate will change. So this will get, and I've talked to Ithaca says she just updates this every year. They pass it as part of the budget. She actually feeds the personnel numbers to her staff, to her department heads. So again, department heads aren't changing numbers because it's coming off of their pay schedule.
So every year then an employee would have CPI plus 2%.
Not necessarily the 2% or $1 is only at their step. They get that one time. So they would, so for example,
On the third year.
yeah, so they would only get CPI on their annual, in the January first payroll in January, it would change their annual increase. The step increase happens after their anniversary date. So for example, if they are making $26 an hour on their anniversary date and CPI hasn't happened yet or was 0, it would become $27.
And it stayed there for 3 years.
And it stayed there for 3 years, other than changing for CPI in between. They go the 3 years, let's pretend CPI got them to $27.75.
Wouldn't it just be easier to give everybody the first of the year, so you don't have to do it mid-year?
I guess I'm still debating that one. It kind of, the challenge is if I have staff that started mid-year, then they lose. So it's kind of a, because I think Christina, I think we talked about this. We said there's a, and I can say the union agreement is on their anniversary date.
It's also a lot harder to budget or if it's mid-year.
Yeah, and we can kind of pretty much,
It's doable.
yeah, it's basically, there's only gonna be step increases for certain staff.
Okay.
I guess I kind of lost me, so
Okay, that's another.
on this point.
That's okay.
Let's just take zoning code, $35, you're hired at $35 an hour. And then after 1 year of service, you get $36 an hour plus CPI.
Yes.
And then what's the $1 or 2%?
So basically, we put this in here because originally it was a percentage. And it realized that a lot of times, if you have a very low salary person or low hourly rate, the percentage is a lot, there's not as much of an increase. But when you have a higher salary one, percentage is pretty high. So we did here, what I suggested is to have the higher of either 2% or $1.
It's negotiable.
It's basically whichever one is more beneficial to the employee. Pretty much, it never was 2% unless you were a much higher paid employee.
So after 1 year, this person will get $36, and then another dollar, 37?
They only get that $1 step the one time. And that, or for the, it doesn't, they don't get $1 every year,
There's $1 for one.
just $1. So year 2, they get the $1 increase. Year 3, they only get CPI increase. Year,
So when you enter that step, you get the extra dollar.
yes,
And then be every year until you reach the next step with CPI.
Yeah.
yes.
Which then you were talking about, you want to still want to figure out some kind of merit thing.
I still don't understand what percent on $1 means though. And
Well, it means like
you move up to $36.
Yep.
And then that's your salary for the next year, or is it plus CPI?
It depends on when your anniversary date is. So let's we'll talk this through, Dan. I'm gonna do it off the top of my head. So I'm gonna say an employee gets hired January 1st. At the code, as a code enforcement officer for $35. So for the first year, for that January 1st to December 31st, they pay $35 an hour. January 1st of their second year, they become $36 plus CPI because that 35 needs that added on. So now we're gonna pretend they're $36.50. Round numbers. So for year, from January 1st to December 31st of their second year, they're at $36.50. Okay, now they're on their third year. So they're $36.50 plus CPI. Let's pretend that's $37. So now from January 1st to December 31st of year 3, they're at $37 even. Now, when we hit year 4, January 1st, they now have $37 from their year 4 plus a $1 step increase. So they're at 38 plus CPI. 38.75. Let's just pretend. So year 4 now from January 1st to December 31st, they're at 38.75. And then we start again where we're just getting CPI increases till you hit that next step.
So that all makes perfect sense to me, but the 2% on $1 doesn't seem to be figured in.
What's the 2% for?
The 2% is there is basically trying to make sure we have equal increases between staff. But as I said, the 2% only comes into play if you look at, for example, the highway superintendent. If you look at his steps, they go $1, $1. But then when you hit year 5, step 5, it becomes $1.02 because the 2% became that much higher than $1.
So this might be easier to understand if it just, in the shaded area, say on the zoning code, until it reaches that point, you just say $1.
Yeah, and you pick one or the other and then it's consistent.
Yeah, and so when I did this, Dan, I was basically trying to see what would happen. So most likely, yes, I'll just take that 2% out. But I had to leave it there. I didn't, it's a calculation. I was basically saying which one's higher.
That's something we wanted input on. It was either
Yes.
2% or $1. We're like, well, we'll go to the rest of the town board and see what everybody else.
Yes, so yeah, again, we can change that. This was kind of a learning, like what's gonna make sense. And so that's why that's there. So most cases, yes, we'll probably just take that out and make it $1 because in case, most of the time, it's not going to come into play until you get to a much higher
It
salary.
becomes a longevity bonus.
After step 5, it's a longevity increase. There's no longer a step. They basically get a one-time payment, a taxable payment, yes.
Okay, I don't know.
2%.
Not a 2%. Longevity, the longevity will become a different calculation and a different, and it's usually a flat amount. It's like, in fact,
Like a
it's $500, $750, or $1,000, depends on the number of years of service passed.
But the 2% would in effect be a longevity bonus too. If you were getting a $1 increase, it not matter, but when you reach a certain threshold, 2% is more than the $1.
Right.
So sounds like there's a double longevity bonus built in. So if you have a separate longevity bonus that can reflect them on the sheet.
It's not, I was trying to keep it to simple terms.
So there are two longevity bonuses.
There could be, with only longevity only comes into play after you've been employed for 10 years.
Or reach 5 steps.
Yeah, which is after 5 steps.
yeah.
Yes, Rick.
I have a question, teacher. So when we're looking at this, the part of the proposal is that we're gonna take everybody and we're gonna do a leveling to reset. Does that mean everyone effectively is at step 1 this year? Or does everybody get leveled out to basically how many years of service they have?
Everybody would be at their step.
Are you gonna have any challenges with anybody we have who's maybe only been here 2 years, but has 20 years experience?
Let me think for a second. I don't want to say no until I think about it.
And should maybe not really be at step 1.
So the only new hires we have in 2025. Because all of these are going to become what happens in 2026. The only 2 new hires we have, like 3. Are 2 code enforcement and a part-time code enforcement. I would say neither one has massive years of experience from my knowledge. I didn't interview them. And then we have a new hire for Dryden Fiber. Again, he doesn't have, he has experience, but not massive years of experience. So I would say no. Any other hires are gonna already be up at step 2 or step 3.
Okay.
That we have hired in the past 4 or 5 years.
Okay.
So you're proposing to make this retroactive, taking into all employees and putting them into this system. And looking at their histories and then making these salary adjustments.
Again,
Which is, I guess, resulting in these large swings that showed up on the budget. Which I don't think we can do. Is that it's just not how public budgeting is done. If they have such swings in salary, that become disruptive. So I'm wondering if we could think out a better transition plan. And I see the benefits of what you're proposing. I just don't think we can just put it in place without some sort of adjustment, transition, and be done. And also, changing job descriptions. And we have some positions that get a new portfolio right on the desk. They have to do it. How does that get accommodated in this? Previously, because we can look at salaries individually, and say, okay, this person's doing this now. And we have bumped up salaries. This would seem to disallow that.
So I kind of got 2 questions in there. So the first thing is yes, this year causes a big swing. But the goal, the plan and the intent is that after this, there would not be a big swing. It would be a consistent increase by CPI and minor increases by steps. So we would have a consistent increase, not wide varieties. So when budgets requests come in, there won't be the variety that we have now. Right now, we have our current budget has everything from a 20% increase to a 2% increase. So it's not consistent. So this is going to provide yes, there is a jump this year. I understand that. But then after that, it would be a consistent increase. Your second question is about as we add either new job titles or new staff. Yes, we will have to come back and visit this and add a new level, a new title, and add them in. So that will happen. We know that. I mean, it happens. Like we already have proposed a couple proposed ones that have already been in discussion that we said, okay, well, let's put them in there so that they are and ready. But yes, things change, people change, needs change of the town. We might need a social media presence. I don't know. I mean, something like that suddenly we're gonna know.
Yeah.
Well, then it's gonna come back to the board because every year the board will have to approve the new pay schedules with the CPI. And if we need to change any titles or add titles, we would do it at that time.
So just to go to the bottom line, so how much it will cost us this year to make this adjustment?
So that if we did everything by employees and by the years they've been here, it's looking at a possible increase to tax levy of $173,000 in 2026. After that, you will see a consistent lower increase of, I'm gonna guesstimate between 30 and 50,000, and that's a normal just CPI COLA increase for all town staff.
But we're not doing CPI this year.
Right, there's no CPI this year because this is all correcting everything.
So by doing that, we're actually saving 40.
Well, I don't know if saving as much as we're just correct, you know, like because of the correction, we're still gonna have an increase because of CPI. But we're having a larger increase to, suggested larger increase to,
If we did CPI, we'd be going up 31.7.
yes.
If we go up to this one, we'll be spending an additional 131 by days.
Yes.
So, it's just.
I
She's saying we're in for the health insurance.
Yeah.
That's, I mean, that's part of the reason the personnel committee, we had this conversation, like I said, to say, well, what. This is a big jump and we understand that. What can we offset? And that's why we had the conversation about the health insurance. Which, you know, has been kind of building over the years, but it made sense to do them both in the same year. When you think about it, you're giving employees more money in their pocket, in their paycheck, both in a salary increase, but also a decreased premium.
So if you factor in the 59,000 savings, that means we're increasing we're going up an additional 82.
Yeah.
580 than we would if we took. So we're talking about an increase of 82,000.
Yeah.
Over what we would have done by the 41,000.
It's
Well,
like,
I think this is, and the scheme works going forward, we have hit this equilibrium just fast with our staff going over the salaries. For hours in these special meetings. And you just arbitrarily bump them, I don't think any went down, but to bump some of them up by 10 to 20 or 25%. I still think that is easy to justify.
so the challenge is,
How can we do this that has a more smooth transition as opposed to these Herculean jumps in salary?
What if we cap the percentage of the jumps? And said, we'll jump them based on the calculation, but if you hit, we're not gonna raise anybody more than 20% this year, and then we'll reassess next year. I'm just throwing out numbers.
Okay.
I'm just randomly throwing out numbers.
the challenge is gonna be finding is tracking that. It's going to be how do we ensure that things continue next year and we don't have the same conversation again? So,
Well, what about like using the higher rate as the. Like, because I think a lot of the junk comes from the amount of time people have been here. Versus what they're paid currently. In a non-step system. And then when you look at what the step system would create based on the higher rate, that's where some of this junk is coming from.
and the thing is I don't wanna have to worry about is, for this staff member, or this staff member, well, they've been here 15 years, but they're actually still at step 4. Like that type of trying to track that could be problematic.
So realistically, there's 4 positions in here that are over 20%.
Yes.
2 of those are, we're talking 29% increase, 28% increase, 23 and 22. Again, I would not agree with the methodology, but that is like a really, there's a 31% jump as well. Is that all because of the number of years here, or is that because the compared
So,
Things are so very high.
so let's look, if we go through and look at 29%, that's a comparison jump.
Okay.
That's a comparison. The 23% is years of service. The 28% is comparison. And the 31% is years of service and comparison. That's one of the ones that's below the
Cost of living, minimum living wage.
So that one's one that needed to be seriously looked at. There's a 22%, that is years of service. So I understand the thought of, well, we only do some, but not all. I concerned about that for them making sure, like, it's another thing I gotta go, okay, well, can't put you there, but I can put you here, but you're not fully in the STEP program, you're not fully in the, what we're gonna adopt. And so that's why I'm hesitant. I'm not saying we can't do it, but I'm hesitant to go that route.
Yeah, and I think it does give at least me pause when it's like the jump is because people are below cost of living.
Yeah, I mean, there's only one that's extremely below the living wage. Others are close, but not quite, and so this at least gets them closer, gets them above, but it's not as extreme. I also don't think it's, if we have someone who's been here a number of years, is it, if because the number of years is because of their higher step, should we be
Whatever we do, we have to be consistent, because we're also telling people they're not gonna get merit raises in the future, so.
they're only gonna get CPI? Yeah. So.
Well, I think we gotta figure out a way to make transitions within our 6% bandwidth. And I think we gotta figure out a way to review, justify the initial step one. Step the significant funds, but I think we've gotta show that we're looking at more than 2 municipalities. Justify it in the places and set up. Still uncomfortable with the, well, I've said. And looking at those 2 municipalities, it's problematic as a sample size.
Any municipality, I think, will be problematic. It's gonna be challenging because we're all so different. None of us are the same. We're trying to, basically, the goal is to say. Those positions within the towns, even if the towns are different, are still the same tasks, the same responsibilities. And that's we're trying to say that's the level ground. And that's what we're trying to compare to. We're not trying to compare to because they're larger, because they have more tax base, because they have more staff. We're not trying to look at that. We're trying to say, if you were gonna go be a court clerk in any other court clerk position, it's the same responsibilities, the same tasks. And so that's what we're trying to look across. So that's the goal.
Then you have to look at more municipalities.
Well, then we need to go do some more. Again, I'm one person, and along with Leonardo and Christina to do this. And so we had to look at our time and what we could do and putting this forward.
Well, plus we were looking, it's like, we're kind of like an island. Cause I mean, like where I came from, Bay Area, it's like we had cities on top of cities that were almost identical. So it was easy to do. Here, it's like we have to go to like Syracuse area or Monroe County to get something.
Well, that's why using a regional calculator that's what I do. You know, I punched a couple things into Indeed. Some of them don't come, some of these job descriptions don't come up through that tool, some did. I don't know what the best tool is.
Well, we could look at like Town of Vestal. That's not that far away.
Well, but that's still just one data point versus using something that's.
I think it's important.
Yeah, but if you're gonna, places that have like, kind of an education-based economy, you're talking about Geneva, you're talking about Rochester, Syracuse.
Yeah.
Well, those are
Then,
cities.
like, you know, surrounding big.
Well, towns.
Yeah, but we would have to get 7 around to center.
Well, we are.
Because we can't go to like.
We are.
We don't have the institution here, sure, got a lot of workers here, it'd be like in the or something. That's next to the university.
Yeah, but I'm like, Town of Ithaca, we don't get many people for
And
that.
also, I mean, adopting the week that we're doing salaries or the month that we're doing salaries, problematic for me because we've not been operating with this scheme this year.
Well,
It seems kind of arbitrary to just adopt now, like our staff, assume we were using the other methodology here. So, and I assume that we're using the other methodology here.
I guess, we knew it needed to change. Yes, we started late, I'm not gonna argue with that.
We wanted to start earlier.
It's as it could be, if we're doing it right before, that's the budget.
Thank you, yes. So, yes, we started late. And so we did what we could in the time we had, and we're trying to present the board with as much of the information we could as succinctly as we could.
So we're all in agreement that the model was sound.
Yeah,
Yes.
I mean, we've been kicking these things around for years. So, like, whenever we make changes, it's never gonna be the best time.
So my takeaway is that we need to, my takeaway then is that we need to get some more data to add an additional column in. And we need to make sure that we find a tool that works. One of the things about tools though is you don't have to call around a bunch of municipalities and do all your own math, right? If you mentioned a couple,
Databases.
yeah,
Like, indeed.
like, yeah, a couple came up on Indeed, a couple didn't, that I typed in because some of the job descriptions for the county things didn't come in. But I know these things exist out there. Is there value in trying to
But is this value in trying to find more, you mean?
to cross check it against something where you're working off a massive database that just provides these lists? Like I know our HR department at my other job, they have a subscription to something, you type a job in and it tells you these are the 3 tiers within, rural areas of, the Northeast.
Yeah,
Bam.
like a salary.com.
Yes.
Yeah, I've had.
So you don't have to call around and do the math and spend the gobs of time trying to figure it out, right?
Yeah.
Yeah.
We're looking at is just what is the higher rate for these different titles, and then when you're looking for the like a. Just a number to plug into these higher rates and then use that as the base to get to. Well, might
Show you is what is not a higher rate, but they're typically gonna show you is this is what this person gets paid today, regardless of how long they've been there.
I think we're basing
So-
everything off higher rates. So
Right, a higher rate is base salary for X person, comparing it to that.
yeah, but we're basing this off of is the higher rates and then spitting them into where the slot is, and that's where some of the stuff.
We could do a comparison, I looked a couple up. One came in lower than this one, another one came out exactly the same as the numbers you guys did. And I don't know if it's worth. We'd be able to take a lot less time to do that.
Yeah.
To do kind of a comparison to see. How close are we here using a much bigger database? Points of data than just Ithaca and Lansing. And I'm just wondering if that would help move the conversation forward.
It's for the board, what's the board want to do? I mean, like Jason said, if you want to pass the formatting. The format, I guess is the right word, and then we can work on researching, getting more information, then yes, that's.
But without killing yourself trying to call a bunch of places, because
Yeah.
that's just too much work.
Well, if we have to, why not just weekly pay for a month's subscription to something?
If we really have to, so some of those are Indeed is available for free.
I
So,
think some of them are I think the salary.com is an annual, cost. I think the one time I sat for one. It was like an annual.
You have to reach out to Association of Towns, to see if they have any sort of.
I didn't.
Database or guidance.
Yeah.
I wish they would.
Yeah, Association Towns,
Look at. Did you provide that?
yeah, and I can tell you civil service will not either. Civil service will not, it does not, the only thing the one time somebody asked that question, they said, all we're concerned about is you're paying above minimum wage. Civil service is not going to, and they won't provide me the information either. Like, I would have to basically, and honestly, I do try to check it a couple times a week. I look at the postings, the civil service postings, like, okay, what are other municipalities in Tompkins County posting for a hire for a position.
We don't have it.
Yeah, which I've kind of like gauged and watched and kind of, but I don't have a document because I basically can only go off of that posting.
So I do think this makes sense going forward. I think we have to have a way to transition to. Just have a. Step.
So
And essentially, the jump to transition jump over time. That's what you're talking about. Because we are talking about money. That's basically what it is. But we do it once for all. Okay, and we take what it is now.
Yeah.
You want to step that increase over time, which means that we are talking to the budget, that in the budget time, we're talking about the same thing again.
So there needs to be a way to phase our current employees.
I don't think so. Dan, the other thing is we can say that, but then we don't know what's coming.
Yeah.
And then we're gonna make a promise to people that we're gonna do a 3-year phase and then in a year. It just, to me, that's gonna feel like we're setting ourselves up to then have to back out a bit or something, and we could really get ourselves in trouble.
If we're going to remember this structure, it's a sound structure, and we are concerned, it's about how much money we need to put, in order to make it work this year. And that's what it is then. When we say here, it's not about a transition plan. A transition plan needs to be done anyway, right? But it's about how much money we're gonna spend this year to get that structure already in place. That's all we're talking about.
Based on this, we're talking about an based on this, we're talking about an $82,000 change in the budget.
This is something that we need to manage.
I think I'm missing out on this point here. No, we have certain lines that are gonna increase 20 to 25, maybe 30% increases. We can't do that. I'm against doing that.
So one of them is just to
make
get
clear.
One of them is just
I
to
don't
get
think that's fair for other employees, see that sort of increase and I don't think it's good budgeting. So that's the transition I'm talking about. How do we smooth this out so we don't have these sounding loops and sour?
I agree, but one of those is just to get somebody above living wage. So out of one of those giant jumps is because of that.
Yeah.
So
I don't know which one you're on, but they've been here long.
The 31%.
It's
No, don't they?
The 31%.
they've been here.
Okay.
Actually, all these have been.
Yeah.
and that's just barely above one of the other ones. So below, so. I think that, I mean, to me, that's a valid thing. It's like,
The only other one that was like plugged it in because of the chart of the. Not to be a photo with the one. Parallel. Right. Thing and some.
Yeah, that was like
Everybody's on Myers part.
I think it was 30,000 more.
Yeah, so that's the thing I was thinking of, it, like, it's pretend, because I think it doesn't have it, because they pay more.
Yeah.
yeah, but that one in Indeed came out at exactly what's in the proposal.
That's
amazing.
Yeah.
Like,
And we
we
have
can
like
pick
number
it up
one
or something.
person shop, does everything, except for hiring. Camps.
But that one was, it was a $12 an hour difference.
Yeah.
What we're proposing.
And, dollars doesn't. That enough job. Which the budget is there, which is.
I don't think we should be doing performance reviews in public like this. I mean, I think we can talk about lots.
Agree.
I think we've got to be wary that there are some large increases in care that are difficult to get.
So the question was
requested.
Yeah.
The question was asked of what it would do to the tax rate. So using the number of 80,000, just as a round number. To increase, if we had no other changes, we take the tax rate If the tax levy, if there was no other changes. And we increased it by that 80,000, it's a tax rate increase of 1.1%, a tax levy increase of 2.6. That's to get it to just 193, which is everything. So you could say it's a 1.1% tax increase over a 1.5.
What does that come out to as a household impact?
Household impact, it comes out to $12.80 for a $250,000 median price home. And so
12 bucks, but compared to the 41 or 40, let's just say 42,000 increase.
it's going to be, right here and see, not that much. Yeah, it would be a $7 difference in $250,000 median home.
I don't even value cross-checking the numbers. Just in case we have any of these, like Dan said, some of these I mean, it was kind of shocking to see some of these percentages.
Yes.
So, cross-checking them against a regional. And at least understanding where we're at with that. Just to, you know, because that may adjust, may or may not adjust the shock value of some of this.
Yes.
I struggle with the idea of multi-year tier into it because I just feel like when we're making promises that, and we don't know what's coming in future years. I know you guys feel more confident about future budgets.
Well, the thing is like if you talk about trying to get those, it's what, if it's 4 position, well, one, I'm not counting the big wage, so it'd be 3. Depending where someone is within that step zone. I mean, if you're looking to soften the financial impact. Could make a case to spread it out. While they're within that step. Depending on what it is, do it over 2 years, which is what you'd have to commit to.
You're just making it complicated.
Yeah, and it wouldn't make that much difference to all of us at the end of the day. For 2 years.
Not expensive.
So if the board agrees or would like to approve the format, I will go back and with personnel committee's input to look at some regional numbers. I also did want to just check with some department heads because I haven't released this to department heads until we had a conversation. I at least need to say,
No, because they'll tell people and then people.
that was my concern and why I didn't release this until the board had a chance to start to look at it and have a conversation about it. So I thought that was really important. And I can tell you, I had a couple of department heads that were like, well, can I have that? And I'm like, no, you can't. So I would like their input to ensure that I have the right titles. I mean, again, I'm trying to just use civil service titles. I'm not trying to get fancy. Trying to, you know, account for all of that.
So we need to decide if we want the 2% or the $1. And then we also need to look at the steps and see if that's what we're happy with, the 1 to 3 years, the 4 to 6, 7 to 9, and 10 or more.
I just do 2%. People like percentages more than $1.
But it's 2% of a.
I know.
It's not as much.
It's not, I'm just saying. It keeps everybody, it keeps all, no matter if you earn 50,000 a year or 80,000 a year, you have a equal increase.
Yeah, I think this will be great going forward, new hires. I think the problem is trying to just put it in place. And then, yeah, they put out these changes inside. I'm hoping to hear what you have to bring me that. And also to make sure these initial step 1 are properly justified. And maybe for the ones that are beyond the 6 or 7% increase, then we have to just exempt certain solutions from the grid.
Anytime we have, exceptions are never easy. I know, so I caution against that because then we get employees talking and it becomes problematic. So I guess I caution to that. I'm not saying we can't, but I caution it. To say, oh, well, these employees follow this rule and these employees follow this rule. That becomes a challenge.
But you're instituting a big change, and I think making a change adaptable is, it's not radical thought, you know? And again, I'm not saying that's what we're going to do, I was thinking, we need to look at what our options are to adapt this to our lived reality here. You know, I think this is going to vary, and I think it'll be good in practice, but I do think there's a adaptation phase of this that we gotta look at and figure out how to make that smoother, so there aren't these wild swings in the pay rates.
Okay.
The Rick texted, I guess it's someone, there's a website called C3.
Yeah, that's. what
Every
it's-
state employee pays.
Yeah, but that's all our current pays.
Yes, I don't know how long we've been there.
Right, does it give you averages or it just gives you,
I've never even
Yeah.
done that before, so
it's too hard.
Yeah.
I don't even know.
Yeah.
How much does salary.com cost?
I have to go look at it. It's been a long time since I had it.
Does that have starting pays?
I don't know. I have to look.
So do we mind with the decision of the 2% or the $1? To make your calculations more realistic.
Yeah, I mean, these are the formulas that are in there. If it's 2% or $1, I did an if then statement. If, you know, this plus 1 is higher than this plus 2%, use the higher one. So all of these already know it's at the higher.
Okay, we don't need to pick one or the other to be consistent across the board.
No, I mean, I think, like I said, the only time that the 2% comes into play is at much higher salaries. And we only are gonna have a couple, 1 or 2 that even meet that. Basically figure over 100,000. It's the only time 2% comes into play.
Obviously with that.
That we go with the $1, 2%.
Yeah, I think that sounds great.
Yeah, that leave that in.
I don't have a problem with that.
Okay.
Part of it.
And then do we want step 2 to be 1 to 3 years, step 3 to be 4 to 6, step 4 to be 7 to 9? Or do we want to change that?
And I'd go back to where you got this in the first place. And I just haven't seen enough of these type of structures to know if that's within the norm or this type of
It's pretty,
schedule.
it's, they based it on the union stuff. It's
Yeah.
pretty standard.
Yeah, based on I saw the union had one, Lansing had this, Ithaca had a step every year. And then longevity after 5. So I thought that let's keep with something similar to already our union.
Yeah.
So it's a similar process for our payroll processing.
Do you want to make it identical to what the union?
No,
No, they'll renegotiate it and then it'll be different.
Okay.
and then it's 15-year before we get longevity. I'd rather give employees the encouragement to get to 10.
Okay,
So that's why I guess I tried to find the middle ground on that one.
after 10 years, you're stuck with what?
Jason, I promise.
10 years.
Okay, so if I come back, I will not be available next week, so I won't have the information. If I can come back, or could I come back with a revised, with more data? Would that be helpful to the town board? And we'll brainstorm ideas if there's a way to reasonably put it in.
I think if you update this sheet with a couple more agencies, I think this is the only sheet you need to worry about at this point.
Why don't we just update one line and just be like, whatever company we pick, like salary.com, and just put that number in?
Yes,
Rather than trying to add the complexity of adding more locations.
Mhm. Yeah, I think that's, I understand getting more data points, and if you get a regional, it'll have it for more, but I guess the key is we want to be careful, we're always comparing the same level, so which is why we like higher rates, because then that's the same, so that's what, whatever we find, I want to make sure it's higher rates.
Yeah.
Not current salaries, because that's.
I go, and you wanna go with medium, because high is gonna mean like New York City, and low is gonna mean. I'm not
Plattsburgh. Yeah.
No, I'll do higher. The median is that. Great.
Okay. So I guess I say that this is gonna take some time, because I'm not here next week. But I'm sure Christina and Leonardo can start the process for us. I guess I would like to, I'd love to see this in for the 2026 budget. I think it's gonna mean 2027 is gonna be that much easier.
Yeah.
And I think we're making let's make the change and go, but that's up to the board.
I agree with
I
that.
had a lot, yeah, I mean, wasn't against it's about race.
Okay. So do we need a resolution to approve this format and then more research? It's knowing that the numbers can change within, but at least here's the format we want to follow, or do we just need to wait until I get more information? Okay, thank you.
Keep it simple. As simple as humanly possible.
Can you add the percentage change back to the budget, perhaps, that will work for?
I can.
Seriously have that.
Yeah, I can, like I've said before, it causes a lot of angst among the employees, and that's why I took it out. I understand that it's helpful, but the chatter that happens back in here is extreme.
A morale problem.
Yes, and so I took it out last year to lessen that.
I think last year we decided not to show them in the
Well, I remember that discussion. Okay.
Yeah, if
They like me more than they like them and.
yeah, or why are they getting more? And sometimes the percentages aren't accurate because maybe the person went from part-time to full-time. Maybe it's a new hire, so it shows a negative. So it's never a good number to look at. And so it just caused more confusion and more problems. And so I'll ask Bambi.
So I mean, we have the correct budget.
No, you have the correct budget.
So you know, everyone can, but I treat people like this.
Well, but the problem is, we're gonna be that number and they latch onto it.
Okay,
And so
if we gotta plot our.
Yes. Yeah, I guess if you're really that curious, it's the best to just pull your calculator out, and then when it doesn't make sense, then you have to come back and go, what's changed? Is it a new hire? Is it change from part-time to full-time? You know, there's all of those pieces.
So we're hoping that every town board member is that curious, that's our job.
Yes, yeah, and there were some great questions on Tuesday night.
Already done.
Some of them went down, they're like, wait, why did it go down? It's like, that's a new hire, and, you know, so there was great questions of what's the change here and why is this?
All right, it's 8:37. I have to get on a plane. Show my aunt's died. That's why I got that phone call. I had to get up Tuesday.
Nice.
Yeah, we're done. So we'll adjourn and then. Until next Tuesday, or the ambulance, fire.
Is that in Caldwell?
And court.
Is that in Caldwell?
Yeah, call.
Next Tuesday.
Yeah, next Tuesday. There is a chance I'll be a couple minutes late, but. We'll start with that.
We're talking about Tuesday.
Tuesday.
She's gonna drive so slow.
You have to share what.
Sam, they don't start at our feet.
And they've all been set.
Yeah, I think they all have set times.
So he's gonna drive really slow.
He drives fast.
And then Thursday night, are you just doing other normal business?
Thursday night's normal, but if we want to talk about this more, we can do it then too.
Yes, if Christina and Leonardo have the information, they can.
Yeah, if we don't, then we'll need an extra meeting with all and we.
Are you working on?
I am, I've got meetings tomorrow morning.
Because we have,
But you, I hope I can make up a list of places that to contact and make an agreement. It's
That'd be great.
Okay.
Yeah, I'll be on email. Okay.
Well, we didn't get to the